Welcome to Radiology Made Easy. Today we'll be discussing an interesting case involving a PA chest radiograph. This is a postero-anterior chest radiograph of a skeletally immature patient. A large, rounded opacity of soft tissue density, measuring approximately 10 centimeters in diameter, is projected over the left mid and lower zones. This is well defined laterally, but the medial border is not clearly visualized. All intrathoracic structures on the left side of the mediastinum are present and are clearly defined, although the mediastinum is shifted to the right. Otherwise, the lung fields are clear, although I note that there is increased transradiancy of the left lung field compared to the right. A metallic density is present in the left axilla, and the pectoral girdle appears asymmetric, being deficient on the left. The left second to fifth ribs are slender in comparison with the corresponding right ribs. The lungs, mediastinum, and thoracic skeleton appear otherwise normal. The difference in transradiancy cannot be explained by patient rotation, since the patient is slightly rotated to the right side. The fact that the borders of the mediastinal structures remain clearly visible suggests that the large density is not in contact with these structures, and accordingly may not be intrathoracic. The chest wall anomalies are likely to explain the mediastinal shift, although it is possible that the large density contributes anteriorly. The combination of left-sided chest wall deformity, metallic density in the left axilla, and a large left-sided opacity suggests this is a surgical implant, most likely pectoral, with an underlying diagnosis of Poland syndrome. Review of any available relevant previous imaging would be useful to clarify and assess for change, and it would be useful to confirm whether there is a past history of surgery. So our diagnosis is a 14-year-old girl with Poland syndrome and a left-sided pectoral implant. When evaluating unilateral increased transradiancy, check that the side contralateral to the increased transradiancy is not abnormally dense, such as in pneumonia or pleural effusion. Differential diagnoses to consider if findings cannot be explained by technical factors include unilateral mastectomy, Poland syndrome, previous poliomyelitis, pneumothorax, emphysema, congenital lobar emphysema with air-trapping compensatory expansion, restricted arterial flow, pulmonary artery hypoplasia, a lesion constricting the pulmonary artery. Poland syndrome more commonly affects males and is a rare congenital disorder that preferentially affects the right side of the body. It is characterized by unilateral hypoplasia of the chest wall, including the breast, pectoral muscles, ribs, and costal cartilage, as well as unilateral hand deformities. Surgical correction depends on the degree of deformity, with options including pectoral implants and breast augmentation, typically not performed until after puberty. Hand involvement may take the form of syndactyly or complete absence of the hand. Poland syndrome increases the risk of various malignant processes, including leukemia, lung cancer, and breast cancer. That's all for today's case. If you found this video helpful, please like, share, and subscribe to Radiology Made Easy. Thank you for watching.